Healthcare is such a big part of the economy. It's about 18% of the economy. Our projections are that it will continue to increase.
It's not what we spend, it's what we get for it. And there's a general common belief that we're not getting our money's worth.
I don't think that we'll ever not be talking about healthcare spending. I think that this will be a perpetual conversation. The hope is that each conversation makes a bigger and bigger dent in the long-term trend of healthcare spending.
Every day that passes, it gets more and more expensive to reform the system. We have the opportunity to put healthcare spending on a better trajectory so that we're getting more value from the system and so that our public insurance programs in particular are sustainable for years to come. But the longer we wait to do that, the bigger the financial hole we're in.
It's especially important now because there's a lot of movement towards high deductible health plans, and out-of-pocket payments are becoming more and more common and more disabling, or financially toxic for families.
If we don't have this dialogue, I have two real concerns. One is it's already difficult for patients to receive much of the care they need because of the financial constraints, and this will only get worse. And second, for all of us, we want to look forward to a healthcare environment where more and more diseases are treated and even cured.
How much should we spend? How should we finance it?
What are we giving up with higher healthcare spending? Are we prioritizing our resources effectively?
We want to dig down into the soil, if you will, and get to the root of the problem. We want a number of stakeholders to join the conversation and to really have a dialogue moving forward.
To make progress on this issue, though, we need to involve clinicians, doctors, nurses, other health professionals, their knowledge, their expertise in spending money better. We need to involve employers who have a lot of influence over how their employees get their care. And there is a role for government in making it easier for consumers to get the information they need and for healthcare providers to try out and succeed in new, better models of healthcare.
What we need to do is to have an honest dialogue where we look at the costs of various types of healthcare, but also the benefits. Not just looking at one aspect of healthcare, but all of it, getting below the surface so we can understand the problem and get to a point where we spend our money wisely and patients get what they need, and we can continue to have this extraordinary innovation that is starting to happen.